The question, is fibromyalgia a somatoform disorder? For the purposes of this chapter we take an inclusive view of disorders loosely grouped under the somatoform label and cover the following conditions: somatization disorder, hypochondriacal disorder, somatoform pain disorder and chronic pain conversion, dissociative motor disorder, body dysmorphic disorder, functional somatic syndromes, e.g. chronic fatigue syndrome / myalgic encephalomyelitis, fibromyalgia, chronic pelvic pain, multiple chemical sensitivity. Covered better here. How to reverse fibromyalgia now. 4. Functional somatic syndromes. The functional somatic syndromes refer to a number of related syndromes that have been characterized by the reporting of somatic symptoms and result in disability rather than on the evidence of underlying conventional disease processes. Many such syndromes have been described. Some of these, such as irritable bowel syndrome, are well recognized within mainstream medicine, but others, such as sick building syndrome, are not. All, however, share the feature of a disconnection between subjective symptomatology and objective biomedical pathology. Most medical specialties have at least one functional somatic syndrome. See Table 2 for examples. Living environment. We have discussed above the possible importance of the early family environment in predisposing someone to suffer from medically unexplained symptoms, e.g., by experiencing the illness of a parent in early life. However, the behavior and attitude of close family and friends can also play a role in the maintenance of medically unexplained symptoms. For example, partners of patients with CFS/ME are more likely to make physical attributions about their partner's symptoms than the partners of fracture. Clinic patients, Butler, Trotter et al. 2001. Clinically, it is often as relevant to understand the illness beliefs of close family as it is the patients, particularly when the family are providing high levels of care and support. Financial reward. The financial reward to be gained from disability payments or litigation has been argued to play a role in the maintenance of ill health in those suffering from somatoform disorders. Mallison, 2002. For example, being in receipt of sickness benefit or certification has been shown to be a poor prognostic sign in CFS/ME. Cope, David et al. 1994, Bentel, Powell et al. 2002, and fibromyalgia, Witchers, 1996. Whilst the whiplash syndrome does not appear to exist in countries without an insurance/compensation culture, Schrader, Obelianin et al. 1996. It can be necessary to rationalize inappropriate medication, as some patients with somatoform disorders are prescribed medication that is unnecessary or even harmful. This needs to be done by, or in conjunction with, primary care, and the rationale discussed with the patient in advance. L. Aleph, A. W. K. L. Dunbar, et al. 2002. A case control study examining the role of physical trauma in the onset of fibromyalgia syndrome. Rheumatology 41-4, 4503. Anderberg, U. I. Martin-Stilter, et al. 2000. The impact of life events in female patients with fibromyalgia and in female healthy controls. European Psychiatry 15, 295,301. Carson, A. S. Best, et al. 2003. The outcome of neurology outpatients with medically unexplained symptoms, a prospective cohort study. Journal of Neurology, Neurosurgery and Psychiatry 74, 897,900. Chambers, D. A. M. Bagnall, et al. 2006. Interventions for the treatment, management and rehabilitation of patients with chronic fatigue syndrome, myalgic encephalomyelitis, an updated systematic review. Journal of the Royal Society of Medicine 99, 506,520. Craig, T. H. Drake, et al. 1994. The South London Somatization Study 2, Influence of Stressful Life Events and Secondary Gain. British Journal of Psychiatry 165, 248,258. Check out the link below for a guide on long-term remission or to join in with the community.